Wow, thank you so much for the warm welcome. My name is Dulcy Rakumakoe, Dr. Dulcy Rakumakoe. I call myself a gender affirming medical practitioner. Once you start working in low income communities, you realize that the issues around accessing healthcare are not just about cost. It's not just about affordability. One of the biggest barriers to accessing healthcare is the attitudes of providers. You know, when people go and try and access healthcare and they are met with prejudice, they are met with racism, they are met with sexism, homophobia, interphobia, transphobia. Those were the experiences of my people. And because I've always been openly queer, that was like what people who came to my practice who were queer were sharing with me, that, yo, we are so happy you are here. Now we have somewhere to go, you know, because we could not go to the existing public clinics and hospitals or even other GPs. The sex that people are born with is either male, female, or intersex. So now when you come to gender, gender is what society decides. So society decides because you are born with a penis, you are a boy, and because you are a boy, you will wear blue, because and you will play soccer, and you will play with other people with the same sex organs as you, and like you will fall in love with people who have different sex organs to you, you know. So society decides that there is nowhere where anyone is born with gender. So when we say someone is cisgendered, it means the sex organs that they are born with is aligned to the gender they want to show up in and present in society with. So I am born with a penis and I'm happy wearing blue and being called a boy and being a boy in society. So I am cisgendered. Cis means on the same side, or it is aligned, you know. So when you talk of like in the history, I don't know if we still have cis gay and trans gay, you know. So it was either the same side of the K River, you are cis K.
Oh.
When you go across the K River, you are trans K, you are across. So someone who is born with the male sex organs, and then like grows up and realizes, no, I am not a male. You know, I am a female. I want to show up in society as a female and operate as a woman in society. That person is transgender. So they are the opposite gender to what their sex is. So like whether someone is cisgendered or transgendered, it has to do with, are they the same as what they were born, or are they like different to how they were born? So we tend to say in medical term, assigned male at birth. That is someone who, like, you know, like someone who is born with male organs. We say they are assigned male at birth, but then the gender that they wish to show up in is not what it's not aligned to what organs they are born with. Dysphoria is a term that is used to explain the discomfort, you know. So now you can imagine that I am born or assigned male at birth. I am born with these organs. I grow up and now realize that, wait a minute, I don't want to live like this. I don't want to be a boy. I don't want to be playing with other boys. I don't want to, like, you know, wear like this type of clothes when I go to school, you know. And now you start interacting with other people in society who make you feel unhappy about how you want to show up in society. So there is that constant dysphoria that you are feeling, you know, because now you are not happy at school. You can be bullied as a child. You can be bullied by other children. You can be bullied by teachers. You go to church. You feel like, yes, I'm born with a penis, but I want to wear a dress when I go to church. But then you know that that will not be acceptable in a church because they will look at you as someone who's abnormal, you know. So you are constantly feeling like you are not good enough, something is not right, something needs to change. That is the dysphoria that is like that is because of the gender that you know that you are, but that you don't look like, you know, in terms of society's expectation. So the opposite of that, I call it gender euphoria, you know. So euphoria is about feeling good, you know. It's what people go through once they start the transition process.
Doctor, it is so important that you've explained it like this, because dysphoria it was previously understood as a disease, as if like you are having the dysphoria. But if you describe it as discomfort because of how other people treat you and make you feel uncomfortable, then it puzzles me then why we need to be diagnosed with the dysphoria when it's other people who actually need to transition to accept me. Do you know what I mean?
Exactly.
I've got a friend who actually says, no, I'm not trans. You are trans because you have to transition and accept me. So it fits into line completely
Yeah.
to kind of put it that way. You know what I mean?
Yeah, no, and I always say to my patients that when you transition, you must know that you are transitioning with the people around you, you know. So take them with, you know, on the journey, those that you feel safe around, because it's also important that other people are a safe space for you so that you can be the best, you know, version of of yourself. But now transition with them. If you are in a relationship and you start taking hormones, your partner needs to know, you know, what to kind of expect as part of this process so they can be as loving and supportive to you as they can be. Do not like always see the other people as the enemy, you know, see them as people that must come on this journey with you so that, you know, you are always surrounded by love and kindness.
And then how do we ensure that a person trying to access gender affirming medical treatment is doing so for reasons that they won't regret in the future? I know it's a difficult one.
It is. That's why I think that is why the informed consent thing is so important, and establishing, you know, the dysphoria in having that open discussion, you know, with a patient to understand where they're coming from, like, you know, why they want to start the treatment, what have they gone through, what are they wanting to experience, you know, and do they understand what they are going to experience, and a discussion about what is reversible and is not is very important, you know, in the beginning, you know. So when you put all those facts in front of a patient and they still consent, you know, to the treatment with that information, then you need to go ahead and give them, you know, the treatment.